Yo, what's up? What's up? What's up? What's going on, folks? Top of the evening. Top of the evening, everyone. I hope everybody's had a great day. Pastor Dixon in the house tonight. Drop a little something on while I'm setting this thing up. All right. I hope everybody's had a great day. Looking forward to talking about a few things tonight. Well, it's a whole lot going on. It's a whole lot going on, you know. A little Prince in the background, Sign of the Times. Man, that song was just as real in the late 70s, the late 80s as it is today, for sure. So if y'all give me a minute, I'm going to try to tag some folks, okay? And we can move forward from here. All righty. I'll be right back with y'all. Yeah, just as relevant today as it was when it was released in the late 80s. Sign of the Times. For the Christian folk, you say, yeah, it's praying time. Okay. Working my way through this. Yeah, okay. Little button ain't working as well as it usually do. Of course, I've always learned that over time, I've learned that when there's a message to be brought, distractions gonna come in the way, for sure. But we press on. We're gonna make this thing happen. Okay, let me get a couple of more. While I'm setting these last couple of folks up, turn this volume down a little bit on this. Just want to say, good evening first off to everybody here, but I know that tonight there'll be some of the usual folks that would tune in not participating tonight because this is the first night of Passover. And after sunset, after I think 6 p.m., they will be celebrating the Passover feast. All our Jewish brothers and sisters, and we are brothers and sisters. Ethnicity, religious denomination, these things do not stop us from being brothers and sisters. And the sooner we get an in-heart understanding of that, the better we're going to be as not only a nation, but as a world. Folks, we can do this. Sound like closing comments to me, huh? No, not really. Okay, I think that's going to be about it for tonight as far as tagging folks. Okay. And hopefully you all will share this out. Get some more people to join on in. I see we got some folks on tonight. Yeah, all righty. Good folks. Vanessa, what's going on? LT, what's happening? North Charleston's finest. James, what's happening? Toshiba, good to see you better. Okay, for sure. That's for sure. Dolores, yeah. Lee, good evening. Man. We got to touch base a little bit more, okay? Maybe I need to make a road trip or something as soon as this whole crisis breaks and everything. Good evening. Millicent, what's going on? How you doing? Pastor Alfreda D's Potts. Yes, the Walking Women's Welfare Movement. That's for sure. In the house. Yes. Excellent. Melissa, how you doing? Yes. 7th Congressional District candidate for U.S. For Congress, for the House of Representatives. Melissa W. Watson. Y'all look her up. Y'all support her campaign. I do, and I'm not ashamed to say it. Yes, we all we got. And we need to take the 7th Congressional District from the person who has controlled that district for far too long. It's time to flip. As a matter of fact, it's time to flip South Carolina totally. From the Congress to the House to the, from the Senate to the House. Jamie Harrison for Senate to the House to our South Carolina General Assembly, both the Senate and the House. We need to flip it. It's about that time. A lot of what I'm going to talk about tonight, actually, if I wanted to, I could relate it to the care and concern or the lack thereof that those people that that have the predominant party in our South Carolina General Assembly, who have the predominant party in our U.S. Senate now, who had the predominant party in our U.S. House of Representatives until 2018 when we took that, how their lack of care and concern contributes to a lot of the things that we're going to look at tonight. Okay, if I wanted to go that route, but I ain't gonna go that route. I just dropped it out there right now for everybody. So we're gonna let folks get a chance to get on. Vanessa, you say you're hanging out on the porch. Yes. Social distancing, of course, from the boys. Okay, you say before you no. Listen, you got somebody in the house that's an accomplished tap dancer. And I am so proud of what I see. Man, it does my heart good to see, our youngsters who are devoted to that segment of the musical genre, for sure. He's an amazing young man, for sure. That's for sure. Crystal and Coma, how you doing? Coma Keck, how you doing? All righty. Would you please help me urge church leaders to not hold in-person services, especially with Easter coming? You know what? I'm going to speak to that right now because those same people that are holding church services, and this is my personal opinion, okay? I'm not trying to put my opinion off on anybody. They actually have the kind of churches that I would not frequent. So I'm just going to leave that right there. I'm trying to encourage, regardless of whether it's those pastors or anybody and everybody, to abide by all of the protocols that are being put in place. Social distancing, hand washing, stay home if you don't have to go out. And if you have to go out, make sure that you're wearing a mask. Okay, that's my message, Crystalline. That's my message right there. Please, for anybody that wants to take it into your pastors or whatever, please do so. My message goes to everybody: pastors, lay people, atheists, agnostics, Muslims, Jews, Catholic, Christians. It doesn't make me a bit of difference. The message stands the same. Wash your hands, social distancing at least 6 feet apart. If you're going outside, wear a mask, and better still, stay home. That's my message right there. That's my story, and I'm sticking to it. All right, for sure. Well, it's good to see everybody tonight. I got a little change up of outfit, even though I had the same red scarf on. I'm wearing scrubs tonight, especially to honor those who are our healthcare professionals, who are our frontline soldiers out here. And they're the frontline soldiers, but they're not all the soldiers. They're different areas where people work at, okay? Even inside of hospitals, you have your food service folks, you have your housekeeping folks, you have your maintenance folks. All of these people are vital parts of this movement that has got to be in place in order to defeat this enemy that we call COVID-19, coronavirus. Everything has to be in place. Our retail workers, our folks that are out there in the stores. I wish, though, that Walmart, instead of them just setting it up, okay, you got to, one way in, or counting people or what, supposedly, that they would have some shields for their people that work the registers there, clear shields, like I've seen in establishments put it. They got the money to do it. I mean, they've been paying their people substandard wages for decades. So, and the Waltons are the top 3 of the 5 top wealthiest people in the United States, so they can buy the shields and everything. So, I'm just rambling on, and it's for sure. But yeah, I'm wearing scrubs, okay, because I actually have another tie aside from my wife being a healthcare professional. I'm a former healthcare professional myself. I used to be a surgical tech. I'm that guy that used to stand in the operating room, right, and assist the doctors when they did surgeries. I've seen the human body turned inside out. I've had my hand on a beating heart. I've helped assist in amputations of lower limbs and upper limbs or joint replacements. I've assisted in those kind of surgeries, and I've helped deliver babies. Quite a few babies, both vaginally and naturally. Okay. It's all part of my resume, all part of what God brought me through to get me right here. For those who might try to discount me and my history, want to talk about he been to prison, man, you should have the resume that I have. Then you can really talk about me. Okay. For sure. Just wanted to drop some out here. Okay. Just in opening. Those are like that's a whole lot right there. So let me back up and take a look at some folks that's here. All righty. Yes, yes. Felicia, how are you doing? Yes, yes. I'm still fighting the good fight. Okay, for sure. And you stay in there, hang in there. We will make a difference in Atlanta and everywhere. We just got to keep fighting. Okay, Missy, good to see you. As always, been great conversation today. Grinder Monty Mo, my brother in the house. Always, always. Yes, yes, yes. Brother Hamilton, William, what's going on? How's it going? Kissy, I think it is. Please correct me if I'm wrong. I hate to mess people's names up for sure. William Hamilton, did the Overcomers Church on Rivers Avenue really have a full parking lot tonight? William, the only way I can tell you that the Overcomers Church has a full parking lot if I'm out there looking for them. Listen, to each his own on this whole thing. When you know the truth and you don't accept the truth, that's on you. If anybody that attends that church and is out there, in that confusion, going into a setting where they're not socially distancing each other, or even just attending because their pastor told them to do so, if they've heard any of my lives, if they've heard me at all, they know better. And if they don't know better and do better, that's on them. I can only do what I can do. Melissa, how you doing? Maurice, what's going on, man? I'm proud of you, bro. Straight up. I wish the news would have done a story on you too, but maybe you just ain't linked up right. Let me just put it that way. I know you're down in New Orleans doing your thing voluntarily down there, in order to help out with the coronavirus epidemic that's and it's bad. Yes, it is bad. It is bad. Herbert, how you doing? All right. Brother Damon, what's happening, my brother? All righty. I appreciate that, brother. It's important so people know you have credentials for what you speak, for sure. KC, is it? KC? Give me a thumbs up if that's right. For sure. Excellent. All righty. Sid, good evening. All righty. Well, let's dive on into this, okay? Especially when it comes to this healthcare thing. And like I said, I'm wearing my scrubs tonight. My personal connections, of course, my wife is a healthcare professional in respiratory therapy. She's been in respiratory therapy since 1980. Okay, so she's very accomplished as far as respiratory therapy. And I pray daily for my wife because she's frontline. She's frontline, and she works at both MUSC and Roper Hospital. Okay. And her heart, her gifting leads her to get up daily, no matter what the situations, and still go to do what she can to help people. So I admire her. I'm proud of her. And I'm proud of all of our workers out here. And like I started to say, not just our hospital workers or those frontline soldiers like my wife, but also those who work in the hospital and those who are in our retail outlets and those who are still driving trucks out here to make sure that we have groceries in our stores, and our law enforcement officers who are still out here. North Charleston, I would appreciate it if you all are going to be at events, wear masks, please. It's for your own safety and the people around you. This is not a prejudiced or biased statement. Wear a mask. Put on a darn mask. What does the mask do? If you have the virus, which you might not, or you might have it and don't even know it, it keeps you from communicating it to others because it doesn't go spraying all out everywhere. And also, if you're not sick and there's other people around you who might be sick and they don't know it, and they might have a mask, and they cough over you or sneeze over you or get close enough just to talk to you, and you don't have no mask on, then you catch it. So the mask, it works. It works. And the reason why I said North Charleston PD, because I saw pictures of them the other day, not faulting anybody at that event, okay, straight up, because once again, this is an individual choice. Each one of those officers had an opportunity to say, I'm going to mask up and maintain social distancing like we're being encouraged to do, like we're telling. There's a message in there. It's a message in there when it comes to the Walter Scott shooting, how we continuously hear from law enforcement about if you see something, say something. And when Sen Sanders did something and said, when he saw something and said something, then they demonized him. Message. But, please, everybody, these are personal safety precautions that we're talking about in this virus. I heard somebody earlier today call this virus a predator. A predator. It ain't no joke, people. It ain't no joke. The first death in the United States was on, I say February 29th, others say March 1st. I don't care, February 29th, March 1st. Either way, whichever way it goes, that would be what, 39 days ago, right? 39 days ago. You know how many deaths we had in the United States as of yesterday? In the United States. 1,997 deaths, almost 2,000 deaths in 38 days in the United States. You think this thing ain't no joke? It ain't no joke. This thing is a predator. It's a killer. It's a monster, for sure. Yep. Let's see. It's a serious monster. Horace, how you doing, brother? All righty. Man, keep writing. We need you. We need your inspiration. Cynthia, what's going on? So I'm not going to deal with the worldwide numbers and even the states numbers. I'm going to bring this thing back in close, okay? Because we need to understand, because it doesn't seem like big numbers in South Carolina, stand by. Get ready. It's not big numbers yet, okay? And most of you that have been listening to me talk about this coronavirus since March 14th, right? I haven't been, as I went back and listened to my own messages and checked my notes, I haven't been far off in what I've been saying. And I don't think I'm going to be far off in what I'm saying, because I'm showing progressions. I'm showing how we went from no deaths to more deaths, in other words. So in South Carolina, let's look at it. How does it go? Okay. March 7th, which was 4 weeks ago, we had our first 2 confirmed cases of coronavirus in South Carolina, March 7th. 9 days later, on March 16th, we had our first death, okay? First 2 confirmed cases, March 7th. 9 days later, on March 16th, South Carolina had its first coronavirus-related death, okay? Over the next 15 days from March 16th to March 31st, we had 22 total deaths, 22. So in that month's time from, in that 2 week period, from 3 week period, from March 16th all the way up until March 31st, we had 22 total deaths. That was 15 days, 22 deaths. Today, which is April the 8th, right? 8 days later, after March 31st, when we had 22 deaths, we had 22 deaths on March 31st. 8 days later, which is today, April the 8th, right? Today, there's 63 deaths. Since March 31st, which is a week ago, until today, 41 people have died by coronavirus. Compare that to the 22 deaths that happened between March 16th and March 31st. In that 15-day time, 15 days, we had 22 people died. Now, in 8 days, we went from 22 to 63, 41 more deaths in that period of time. Just today, we had 12 new deaths since yesterday in South Carolina. You see how this thing is starting to increase, how it's starting to ravage our state. And it's going to, because just like the United States of America, when United States heard the warning, China gave warnings in January, late January. Italy, as it moved further west, Spain, as it moved further west, people were sending the warnings about get ready for this thing. And our current administration, the Donald Trump administration, and those up under him, boo-hooed it, called it a hoax, said it was not real, and said it was a plot by the Democrats to make Donald Trump look bad, which really, in reality, and as Pastor Dixon saying this myself, ain't nobody got to make Donald Trump look bad. He does a great job of that himself, okay? No, I'm not a fan. Charles Garrett, what's going on? Ruthie, how you doing? Good to see you. Dr. Bell, how are you, sir? Claire, all righty, good to see you all. Yeah, we had 12 new deaths. Okay, and this was since earlier today. I don't know how many even since then. So you see the progression is not getting better, folks. And the reality is it's not going to get better. It's going to get worse. And it's estimated that it's going to get a lot worse right here in South Carolina. And just as on the national level, those in charge ignored the warnings, so also have those who are in charge of South Carolina ignored the warnings. Instead of making a firm commitment to shut South Carolina down 3 weeks ago, our governor and even various municipality leaders here still to this day have not fully said shut it down. They define essential operations as like liquor stores and gun shops. I saw a television commercial several times. It's like one of the only television commercials seems like it's on TV now about a bathtub resurfacers company that says they're essential services and that they're opening. Come see them. We've done lost our minds, people, with a predator. An invisible predator running wreck, okay? Like I said, 63 today. 41 of those 63 over the last 8 days. And just 8 days from now, that number's going to double. I'm not a prophet. I don't see into the future. I'm just talking what I've seen as far as the progression of the death toll from Italy to Spain to now in the United States and how this thing is moving. In New York, New Jersey, Chicago, man, Louisiana, New Orleans, they under attack by this thing. It's ravaging them. It's killing them. And you know who are the primary targets here in the United States for this virus? People who look just like me. African Americans. Black folk. Yep. Black folk. The preliminary data over the last few days has been startling. It's been crazy to see how as the death tolls and the cases started being, the numbers compiled, how there was a stark picture being painted of the fact that somehow or another this virus is identifying people according to ethnicity, according to whether you're black or white, or brown or white. And the reality of this virus is this virus really does not discriminate. It doesn't. It doesn't care who it attacks. So why the disparities in number? Why is it that there are so many? And I'm going to talk about the numbers real soon, shortly, in South Carolina. But why is it that this virus is going after black folks? Well, it's not going after black folks. What this virus has figured out is that there are hosts whose immune system has been weakened. Their strength has been weakened because of socioeconomic conditions that they live in over time that has allowed them to have not necessarily pre-existing conditions, which some do, and I'm going to talk about that, but also just because we ain't had a shot at living right. Urban communities, people packed on top of each other, living in poverty. You know, it's funny. I heard the New York governor, Andrew Cuomo, today say a real statement. He said this, and I quote, "It always seems that the poorest people always pay the highest price. Now with coronavirus, COVID-19, here we are, poor people of color, once again, paying the highest price." I've put it on my social media pages consistently that we got a new target on our backs as African Americans. It ain't the police this time. It's coronavirus. And it's coronavirus because we've had lack in a lot of the areas where we should have had an equal shot, a fair shot at life. So South Carolina. Okay, let's look at South Carolina. Why do I say this? Here's the numbers for our state. Like I said, I'm not going to go all over United States or overseas, and all. I'm going to stay right here in South Carolina tonight. Okay, the newest figures. These are the latest figures. Okay, of the 63 COVID-19 related deaths in South Carolina, 46% of those were black. 29 of those 63 were black. In a population where we only represent 28% of the population. 28% of the population, and we got 46% of the COVID-19 coronavirus deaths. What's wrong with that? 41%, 26 of them were white, and 13% of them is who DHEC calls unknown. Unknown. You know, and I'm going to interject an opinion into this right here, okay? When I look at the fact that, you know, we have black people represented in this DHEC figures, and we have white people represented in these DHEC figures, and then all of a sudden it says unknown, 13%. I'm going to just speculate, venture out, take my poetic license to say that 13%, those other 8 that have died out of 63, probably represent some area of people of color in some kind of way, be it Native American, Latino, Asian, maybe. I don't know, but I guarantee that it says unknown. They call these folks unknown. But just think, if we add that number, that 13% to the 46% blacks in South Carolina who have died, if we take that number out of the 63 to 37 of those deaths being people of color by adding in the unknown variable, okay, we take it from 46% to 59%. Man, black folks, we're being attacked. And we're not being out and out attacked by coronavirus. We're being attacked by this system that we live in that has allowed us not to have the same consistency of ability, ability to fight this virus off. We ain't had a fair chance. And I'm going to talk about that. In South Carolina, the black population, 28% of the total population, but we represent 46% of the coronavirus deaths. And if we add in the unknowns, 59%. That's crazy. That's crazy. We'll talk about Black Lives Matter. South Carolina's white population. 67% of the total population is white. 67%. But only 41% of the coronavirus deaths are white, compared to 46% black. Yeah, 67% white in South Carolina. And there's a much smaller, 5% less than the black percentage of those dying from coronavirus. That's right. Systemic disparities. That's right. Gina, good to see you. Melinda, good to see you. Yes. Carolyn, good to see you again. George, all right, all right, all right. Yes, yes. April, good to see you also. Corius, what's going on? All right. Wyatt, what's happening? All right, good to see you all. The South Carolina's white population is 39% larger than its black population, but the black population exceeds the white population in coronavirus-related deaths by 5%. That's crazy. But it's understandable when you really understand what's behind that, okay? Why does this happen? Why is it that way? Well, the first thing we got to look at are the socioeconomic conditions that we as black people live in South Carolina. One of the worst states for poverty, let me just say it. And most of those who are impoverished in South Carolina just happen to be people of color, okay? But social economic conditions, okay, dictated. We live in communities and we live lives here in South Carolina where many of our people of color, do not have access to quality health care, okay? We don't. And if we do have access, we can't afford it. We can't afford it. What's going on, Elvin? Good to see you. Aaron, what's happening? All right, all right. Reverend Glover, what's going on? All right. Yes, sir. Good to see you also. And if we do, we can't afford that quality health care anyway. And I know there's many of us, especially of the males, okay, and I didn't even talk about the percentage of males that this thing affects versus females. This thing is targeting males too. But a lot of times we as males, we don't, even do our regular checkups that are necessary. You talk about, well, it's time for your checkup, man. I'm not going. I got to pay that copay and all of that, man. I'm not going to see that doctor and carrying on, And because of that, a lot of times we wind up with with underlying health conditions that have not been diagnosed, pre-existing conditions, what they call them. And those pre-existing conditions are because of the conditions that we've lived in all of our lives. In poverty, on the low end, in communities that have not thrived, high stress, high salt, high all of these, everything else, diabetes high, hypertension high. We run the numbers in all of those as people of colors. And guess what coronavirus said? COVID said, I see a target. That's a willing host right there. And all I got to look for is people of color. And the numbers are reflecting that that's an effective strategy for COVID-19. It's working for the virus. And it's killing us. It's crazy. Our poor housing conditions. Many of us live in no matter, yes, we call it home. But when we stop and we think about home, is it really safe? How many of our homes that we live in, especially in urban areas and inner city communities, that we live in homes that are mold ridden, or they're old and they have asbestos in them, or the communities around our neighborhoods are dilapidated and all of this, and we just happy. But these things are taking a toll on our ability to fight off infections. This is affecting us. And coronavirus is like, yep, right there. And because of that, we're being affected. Not only that, we have this sedentary lifestyle that we live. We don't want to exercise. We don't want to eat right. We don't want to do nothing right. For many in our community, it ain't nothing better than that spent their whole life from a juvenile to senior citizen status with doing everything they ain't supposed to do and nothing that's supposed to do, for sure. This is killing us. It's killing us. And it's making us willing hosts for coronavirus. Not even to mention the fact that within our communities, all we have are these convenience stores. I'm going to be nice about what I say about these convenience stores when I That's right, Dr. Bell, social determinants of health. I would love to just sit down once we break through this whole thing or whatever, maybe we can Zoom or something and just talk to you about that. Get this out to the community that I'm talking to. because I'm trying to reach a younger demographic. No disrespect to the older folks on here, but I'm trying to reach our young folks, because if we don't begin to bring them along their consciousness, not that woke foolishness, okay, but real conscious understanding of the pitfalls that have been set before us that's going to prohibit us from moving forward and make us susceptible to these kind of viruses, till our young people understand it, we don't have a future. And I'm here to preserve the future by building up the present. And the present is a younger generation. Pastor, what's going on? What's going on? Yeah, back to green. Back to green. Full of mold, for sure. But we have these convenience stores, I'm going to call them. If I say what I was brought up calling them, then folks would have a problem. So I'm not going to use that terminology. It's another urban euphemism, but I'm going to leave that alone. But these convenience stores are no substitute for a full-service supermarket with fresh vegetables and fresh fruits there, with nice clean stores and aisles and shelves, and the ability to walk up into, and it's a mental part of that too, to be able to go into a store in your community and proudly shop, because the store is a nice store, But really to be able to purchase these fresh fruits and vegetables and things, and to be able to understand the value of nutritious eating, not only understand it, but be able to go buy them at a reasonable price, not an inflated price. And right now in our communities, all we have are these small convenience stores with high sodium products. Many of them are out of date and should have been thrown away a long time ago. Beer and wine and cigarettes are the main commodity that they sell in the stores, and all the rest is just a side note. Another aspect is that when you walk in right at eye level, you take your kids in because they sell candy and stuff like that. No fresh fruits, no fresh vegetables, none whatsoever. Like I said, high sodium content products. And when the kids walk in and they look, all they see is pornography right at their eye level. This is taking a toll on us shopping, and every month we get the monthly check or whatever we get the check. Where do we go to shop at? Because many times we don't have the ability to drive to an actual grocery store or to pay the price of a taxi to get there. And have you ever, I come out of Chicago, and we got bus systems, but I know it's heck trying to catch a bus and go grocery shopping, especially when you got once a month money. Come on, somebody. When you got once a month money, we don't budget that money out too much. So by the time it hit, we ready to go spend it and go buy it. We go fill up the refrigerator and everything. And then a week later, we got trouble. I'm just telling you what I know. I ain't trying to sugarcoat this thing or not. I come from the hood, There are those who try to discount me. Well, that's Pastor Dixon or whatever, he be with them people, or he with the, the suit and tie people, whatever. Yeah, I'm low end for life, baby. For sure. Food deserts. So all of those things, lack of quality health care, denial that we need to go and see a doctor, resulting in pre-existing conditions. All of these things weaken us. Our housing conditions weakening us. Our sedentary lifestyles because we won't exercise. We call exercise going up and down the stairs in the house, from the bedroom to the kitchen. That's it. And food deserts, not even being able to have access. So as this is weakening, when I'm going to say this food desert thing, when this is weakening our system to the point where coronavirus can have its way and attack us as it wants to, guess who is culpable in that in North Charleston? The same mayor who had an opportunity since 2007, 13 years to build a full-service grocery store on the south end of North Charleston, and just has refused to do so. And I'm going to say refused to do so. I don't care what kind of excuses he give. Refused to. And because of that, people's immune systems are compromised, and this coronavirus is looking for those same people. Beep, 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 beep. Got one. For sure. But I can't put all the blame there now. Now, I know some black folks on here, okay, but y'all don't get mad when I say what I got to say, okay, for sure. If you ain't want to hear the truth, you're on the wrong station, okay? You need to tune to another station, them lying people or something, but I'm not going to lie about it. I don't know why it is that black folk think that they're immune from this thing. I'm going to just put it out there. Man, I've been to Walmart, okay? I try to go and just maybe shop at one time, make sure I'm wearing my mask and that I'm staying away from people. But, man, in these stores, man, and I hate to say it, but it's predominantly people of color, predominantly, that have no respect for what's going on with this virus. Most of the folks in these stores, they're all up, bunched up on people. They got a little line to get in Walmart. Them people, I refused to go in there the other day because the people was all in the line like back to back. They wasn't even spaced out. Nobody had on any masks or anything. What is the problem? I saw a video of two young African Americans, a male and a female, and they were like, man, shoot, we ain't getting ready, man. YOLO. You only live once. YOLO. We gonna do what we gonna do, man. That Rona don't want us. Lies you tell. That Rona is waiting on them. For sure. Yeah. Everywhere. I don't understand it, that we just refuse to comprehend that this virus is even more deadly, and we're even more susceptible to this virus than others are. And we just acting like it's business as usual. Mad because the club ain't open. Come on now. This is crazy. So we can't just blame all of this on our socioeconomic conditions. A lot of it we can blame on just plain old stupidity. When somebody tell you that you can get sick off of something, it's better to believe it first and find out that it's a lie than to not believe it and die. Somebody write that down. For sure. It doesn't make any sense. It doesn't make any sense. Folks out here, and I'm not even going to talk about the churches. I saw Chrislyn had mentioned it earlier, and so did William Hamilton mentioned it earlier about the churches here that are having their people coming in to to service. That's crazy. I'm glad to see that North Charleston's mayor ordered his people who provide security there to stand down. Don't go there. No, because you're condoning that if you go there, for sure. That's crazy, And of course, this is one of those places where, and I don't have no problem saying it, this is one of those pastors that will tell you, because you don't come to the service, then you don't have enough faith. And if you die, then you didn't have enough faith to live. I'm going to just put it out there straight up because I know him, But, he couldn't have anybody in church if they didn't believe the science, if they didn't believe the dead and dying that I'm talking about tonight. And what I'm talking about tonight is verifiable. It's totally verifiable. People are dying, and more people, 12 people yesterday. Remember, it started with 1. Then we had reports of 2 here or 1 there. And then one day it jumped up to 3. Then the other day it was like 4. A couple of days ago it was like 4. And yesterday it was 12. Watch the numbers jump up. If you think I'm playing, I ain't playing. I'm dead serious. So when it comes to this coronavirus, okay, let me just tell you about something, okay? Now, I'm going to make sure that I did remember this, okay? How deadly is it? New Orleans had a case, okay? A case where an 86-year-old woman and 3 of her middle-aged sons all died last week within 10 days of each other, between March 20th and March 30th. She died and 3 of her middle-aged sons died. She was 86. One son was 71, another son was 58, and the other was 61. Half of their family just wiped out. Because of coronavirus. This wasn't because of complications due to coronavirus. This wasn't, any a family that just said, okay, it's that time for us to cut down our numbers or something like that. So get rid of them. No. They were planning on summer vacation still, even at that age, I'm sure. Family reunions and stuff like that. But now they got 4 empty chairs because of coronavirus. Black folks, I'm talking about black folks, see? Black folks. See them? Yeah. A prime target for coronavirus. Prime. It makes no sense. In Louisiana, and this is a fact, 7.5% of Louisiana's fatalities were black, even though they make up 1/3 of the population. 70.5% of the fatalities in Louisiana were black, even though they only make up 1/3 of the population. Okay. It's crazy. It's crazy, but it's real. It's real. So folks, please, I say again, frequent hand washings, 20-second minimum with soap. If you don't have soap, then resort to hand sanitizer when you're out or whatever. But please, soap and water, lather up 20 seconds, okay? That's one thing that's going to help. Another thing is to make sure that you're practicing social distancing. Please stay away from the next man, next woman. No fist bumps. Come on, I saw that a couple of days ago too. Fist bumps, no handshakes. You know, they say to cough in your elbow bump, but I'm like, I cough in my elbow. The last thing I want to do is elbow bump with somebody. Not to say it can be transmitted, it just seemed nasty. That's all I'm saying. For sure. Maintain those. If you got gloves on, understand about cross-contamination. Everything that you touch with the glove and you touch something else, whatever you just touched is going to that next object. If you can wear gloves and you got to scratch your face with that glove on you, it's just like your hand. It's no difference. When you take those gloves off, I don't have any on, okay, but make sure that you do it according to the guidelines. Stick your finger inside of the heel part of one glove and pull it over the glove. Pull your fingers back out to make sure that the outside winds up on the inside. Hold that one glove in that hand and do the same thing with your other hand. Go up underneath and then pull it over so you have both of them sort of neatly wrapped, and then toss them in the trash. Don't just set them on the seat of your car, wherever. Toss them in the trash, because those things could be carrying around coronavirus, COVID-19 virus, and infect your mama, your granny, grandpa, brother with a weakened immune system that you don't know about. Anybody, child. Yes, children have been infected by this virus and died. That whole thing, when they started out talking about it just affects old people, man, that was a serious deception, man. It got a bunch of people tripped up. I couldn't trust them then, and I don't trust them now, because the numbers don't show it. The numbers show that anybody is susceptible, because you don't know what's going on the inside. I know folks that lift, run marathons and everything, but they have an immune deficiency, system deficiency that coronavirus is just looking for sure. Healthy people are dying, people. I want you to understand this. So please, aside from the hand washing, social distancing, and these other things, I just want you to, I'm going to say this, and I mean it seriously. You can take it or not. Any time that you go outside, that you're going to interact with the public, please put on some kind of mask. Please, some kind of mask. Any kind of mask beats no kind of mask. Some kind of mask. It don't have to be no hospital mask if you ain't got it. At least something. Stop whatever you might have from coming out, and from whatever somebody else might have from coming in. Wear a mask, people. For black folk, y'all ought to be happy to wear a mask. This is one time you can wear it, and 5-0 ain't gonna shoot you unless you're doing dirt. Please, Yes, I'm making light of it, but I'm very serious about that. If we, that's right, Dr. Bell, got to clean under your fingers, under your fingernails and everything, man. This thing will be anywhere. You have to minimize your chances of catching this virus in order to stay alive. Because the numbers, that 63 that we got right now, I'll be back on next week. I'm be in between next week and next week. I'll be back on. You will be amazed at what the number is. I'm not a prophet. I don't have no fortune, no crystal ball or nothing like that. I'm just talking about what I believe from what I've seen in various locations, from overseas to right here in the United States. That next week, the numbers that I quote are going to be staggering. And let me put a disclaimer on it. Please, I pray that I'm wrong. I hope that I'm wrong. With every fiber of my being, I hope that I'm wrong about this. And that next week I can come back and say, last week we had 63, and since then it's only grown by 1. Or we haven't had any more, or it's only grown by 5. I pray that that's what, and I'll come back and say, yes, I was wrong. Trust me, I'll have a special Facebook Live to tell you I was wrong. But right now I don't believe that I'm wrong. And only time will tell. And if I'm not, you're definitely going to see me back here again saying, I told you so. And there's still going to be people out tomorrow, because there's folks on here that's going to hear this and believe it and not tell anybody else. Those are the same people that's going to infect somebody that you know. And the last time you'll see them when they say is, I'm going down to the hospital. Because once they go to the hospital and placed in quarantine, you don't get to see them no more. That's it. That's it. The last memory is the last memory. The last hug the grandkids had is the last hug. Once you are in quarantine at the hospital, there's no visitation. You don't get to come to the hospital and say, yeah, get my 5 minutes or what. No, you don't get none of that. As they are transitioning from this life into the next life, you won't be standing there holding their hands. Nope, nobody. It might be a good-hearted nurse or a respiratory therapist or somebody there with a cell phone who might allow some FaceTime. Okay, as your loved one leaves. Remember, it's close to 2,000 deaths in the United States overnight. 12 died here. And out of those, I'd venture to say that better than 90% of those people died alone. Not because they didn't have a family, but because their family could not come to see them because they were quarantined. You want to put your folks through that? I don't. Stop. Get on board. Stay safe. Stay home. The life you may save might be somebody else's or your own. Please. Okay, I see we're rolling along here. It's about 9:22. I see. Let me keep on moving then. Sharon, how you doing? Linda, hey, what's going on? Maria, Chi-Town in the house for sure. LaRon, all right. Brother Charles, I think I spoke earlier. Victoria, good to see you. All righty. Joe, what's going on? All righty. Yeah. Today was a very interesting day. I wish I could just stay on the coronavirus thing, man, but please, from my heart to yours, please. Do what it takes to not only keep yourself safe, but to keep our community safe. It's already obvious that we have people running our state who do not have your best interests in heart, because if they did, they would have shut this thing down 2-3 weeks ago. Period. Nobody on the street. Nobody. Except for authorized personnel. But they didn't. They still playing games with it. Word games. Work from home. Okay. I don't know. Work or home. I don't know what that is. Okay. So please, and I'm sorry for going back to it, please, take it serious and tell somebody else to take it serious. And when you get ready to go out, make you a mask. Please, okay? All righty. Now, today was a very interesting day because of our final contenders for 2020 Democratic presidential nomination. Senator Bernie Sanders dropped out of the race. I'm not here to talk about people's preferences, okay? Whether you're a Biden person or whether you're a Bernie person. I'm not here to talk about that. And I'm not here to tell anyone about where their allegiance needs to be at moving forward, okay? Not in this broadcast. I'm going to do that another time, okay? But what I can say about Senator Sanders, and I wrote it in my Facebook post earlier, is that he has been one of those who, throughout my years of social justice advocacy, has been an inspiration to me through a clear message of social justice for the least of these, how we take care of people. It's been a clear message. I didn't know much about him before 2016, but when I heard his message in 2016, it made sense to me because it was the same message that I was talking about out here in the streets for years. Universal health care, expanding Medicaid in South Carolina, getting people paid a living wage. See, all of these things was in place before Senator Sanders ran for office in 2016. For presidency in 2016. Man, trying to end gun violence by passing common sense gun legislation, making sure that we are protecting our environment so we preserve our environment for our children instead of making a burden for them coming up. Trying to ensure that quality public education is available for all of our children, regardless of zip code or financial status. These are the things that when I first heard Senator Sanders' message, it shows me that this is a great man. And I'm not going to take anything away from him in the fact that, yes, Senator Sanders is a great man and a great message. And wherever he goes and whatever he does, and for all time and eternity, he will forever, I pray, be known as a great man. So it was his decision today to drop out of the race. And I do believe he said something about supporting former Vice President Biden moving forward. But no matter which way it goes, you can't take away the body of work that he's put in, the message, the simple message of how we all can get better that he's put out. And the fact that he's been a champion in these areas for so long. You can't take that away from him. And now it's time to move forward. Because we do have a common enemy. I don't care whether who you are. We have a common enemy. And that common enemy has compromised the national security of our nation by allowing, without putting any opposition up, a killer to invade our borders. He ain't putting no wall up to stop this darn coronavirus, so he need to stop trying to draw a wall to stop our neighbors to the south. Should have put that wall up. More people than died from this. Man, New York, I think in 9/11 in New York City, they lost like 2,600 people. They're close to 7,000 coronavirus deaths in New York right now. It's crazy, man. It's crazy. Nationally, we're up around, I think, 13,000. We're better than 13,000 nationally dead. Okay, and it's going to get worse. It ain't over. We ain't peaked yet. But as far as the 2020 presidential race, I want to thank Senator Sanders and all of the other candidates who put their hat in the ring, because I know that ain't no easy job. It ain't no easy job at all. But they did that. And it's honorable. It's honorable to make decisions based on the good of the people. And I think this is what Senator Sanders did in his decision today. He made a decision not based on his own pride or personal endeavors. He made a decision based on the good of the people. And that's the kind of guy that I know Senator Sanders to be. And I'll never, ever shy away from that message or try to take that away from him. Never. The good man. Okay. All righty. Let's see what else we got here. Oh, Janice, good to see you. Chicago in the house. Jason, what's going on across the pond, man? You and your wife, you all stay safe there, and all of our people there. Karen, how you doing? Good to see you. Brian, what's going on, my brother? Yeah, we're a long way from BCDC, ain't we? But we still praising him, that's for sure. D, what's happening? Good to see you. Sharika, how you doing? Good to see you also. All righty. Yes. Now, as I'm getting close to closing this out, okay, I might have to save a couple of these topics till the next time, okay? But our homeless people, I'm got to put out some feelers because, I heard that there was some stirrings over a week ago that we had a plan for the homeless people, but they're still in the same place, in the same predicament that they've been in. There's no change. They're still out. They're still walking around and interacting with the public. No masks, no testing, no nothing. When we could have actually had them in a single facility, all of our homeless. We could have offered them years ago, really, a hand up instead of a hand out by making sure that, okay, if you're homeless, the way to end homelessness is to give somebody a home. We could have had transitional housing available for every homeless person out here, where we could have offered them all of the services they need to get back on their feet and made sure and help them up in order to get there. And I saw Pastor Alfreda D's Potts on here with the Walking Women's Welfare Movement, okay, and I'm a part of, and we're just moving to try to make sure that the homeless are taken care of. But in this coronavirus pandemic, it makes no sense that now we've been into this thing about 3 weeks, better than 3 weeks. It makes no sense to have our homeless not being housed in a single place. Because the longer that they're just roaming around right now, this is an emergency situation. We could have just given them a place until we get beyond this, and we know that they wouldn't be communicating to anyone, but they could, everything right there for them. But instead, because the powers that be don't think this is that serious, man, we just let them go. And ultimately, we'll let them die and possibly infect a whole bunch of us as they contract the virus. And there's been no kind of control or regulation on how we're going to confine and contain the virus amongst our homeless. Another side venture for that, if we would have done that, we could have also, as of April 1st, we could have had them housed to actually count them for the U.S. Census 2020. Come on, somebody. They would have been in one building, and we could have got them all counted for the U.S. Census for this year at that one place. Vision. I see I've been about an hour already, so I'm going to cut it here. I really did want to talk about the MUSC layoff, okay? But I'm going to hold that for another one, the layoff of 900 employees at MUSC. This is definitely problematic, okay? Problematic. But I'm going to do a little bit more research on it, okay? And then come back in another live, maybe before the weekend or so, possibly, okay? But I'm going to hold off on that, the MUSC layoff of 900 people, especially when I'm seeing the same layoffs and come out. As a matter of fact, I see the other hospitals maybe even expanding, okay? Yeah. Greta, what's going on? Carol, what's happening, okay? So in closing, I just want everybody to know about this petition that's on my page, okay? I need for everybody, please, it's on my page. All of my pages is there. And it's a petition to get North Charleston's City Hall to agree to a racial bias audit, okay? Something we've been trying to do for a long time in North Charleston. Listen. In the aftermath of the Walter Scott shooting, we called for certain things like an audit, okay? And we've been pushing that for years. We got it up Actually, there was a DOJ, a Department of Justice audit actually done at one point. And after Mr. Trump took office and he put Jeff Sessions in charge, for some reason or other, we never did get the results of it. And they said, we're not going to get the results of it. So that doesn't mean that we still don't do a racial bias audit. The city of Charleston has done one. They found certain discrepancies within their department, and they're working actively and aggressively to address those discrepancies to make sure that their policing is even across the board and that there's equity within their law enforcement department. But in North Charleston, they refuse to do the audit that might point out. It might exonerate them, but it might point out that there's some problems. My phrase is, if there's nothing to hide, there's nothing to fear. If you ain't got no skeletons in your closet, open the closet up. And if you got them in there, you shouldn't have had them in there anyway. Open the closet up anyway. So the petition is on my pages, and I'm going to read it right quick, and then I'm going to sign off, okay, because it looks like 9:35. Yeah. Okay, so it says here, and this is actually a combined effort between the Charleston Area Justice Ministry, CAJM, okay, the Legal Defense Fund, LDF, and also the American Civil Liberties Union of South Carolina, ACLU, South Carolina. 3 formidable, upright, equitable organizations that I support. I support all 3 of them, okay? So here's what they wrote, and then I'm going to sign off, okay? I'm sorry for delaying so long, keeping you all so long tonight. Please forgive me. It says, the title is Mayor Summey and North Charleston City Council Police Department needs a racial bias audit. Dated March 30th, 2020. April 4th, 2020 marks the 5th anniversary of the murder of Walter Scott, a black man, father, son, and brother, by an officer of the North Charleston Police Department, NCPD, during a routine traffic stop. Although the officer pleaded guilty to federal civil rights charges and received a sentence of 20 years in prison, people of color in North Charleston and across the nation continue to distrust police and fear for their lives during interactions with law enforcement. This should not be. It is time for North Charleston City leadership to take actions to ensure that what happened to Mr. Scott never happens again. City officials must build trust between police and the community by hiring independent evaluators to conduct and publicly release a racial bias audit of North Charleston Police Department's policing policies and practices. So the ask is for the petition, and I'm asking each one of you, please lend your voice by signing the petition demanding that Mayor Summey and the North Charleston City Council members approve an independent, comprehensive racial bias audit of the police department. Do it in remembrance of Walter Scott and those who have been victims of police violence and bias in North Charleston and across the nation. The petition is on all of my pages. I'm asking you right now to not only go and please sign it, okay? Sign it, but also to share it in all of your networks, all of your friends. Invite all of your friends. And I don't care whether they're on Facebook, Instagram, Twitter, email. I don't care who they are, where they are. Invite them to sign this petition, because power concedes nothing without demand. It never has and it never will. Frederick Douglass said that. And it's time for us to demand that North Charleston City Hall do what's right by the people and have an independent racial bias audit done of their police department that will uncover any kind of discrepancies so that we can clean up that, move forward, and feel safe about our police department now. It's just that simple. So I'm asking everybody, please, please, please sign it. Sign it and share it and ask other people to get on board with this. I don't care where you live at. If you're living in Chicago, sign it. That's all right. You might want to come here to North Charleston and then know before you get here that there's not a road cop out here that's going to shoot you in the back 5 times. You might live in Hollywood or Ravenel. Wherever, Atlanta, once this virus lifts, once it stops killing people, You want to be able to come to North Charleston and know that North Charleston is doing everything it can to protect and serve its community. Everything. And I think it's a small ask, especially in light of the history that North Charleston has had. As far as their law enforcement, it's a small ask to say, hey, we really, really would like to have an independent racial bias audit done right now. Right now. And the petition is going to hold some weight because we're going to demand that it hold some weight. Folks, I appreciate you all. Thank you all so much for paying attention and listening tonight. Share this out to your circles and let folks know. Get the petition out there. Let folks know to take this coronavirus serious. It's a killer, and it's actually killing not just white folks or young or old folks. It's killing young folks and predominantly black folks. So let folks know, you go outside, put a mask on, wash your darn hands and stay away from people. Or better still, stay at home if you ain't got to go out. Don't play with this thing. This thing is a killer. I know because my loved one has got to go and interact because that's what her gifting is and that's where her heart is. And I want her to come home safe and sound anytime that she goes into that setting. So please help me help her to live. I would really appreciate it. Y'all take care. Tell somebody you love them. Please. People are dropping like flies these days. Tell somebody you love them. That's the only way that we together are going to be able to move to the next level. And there is a next level. But we got to get there by loving one another. That's the only way it's going to happen. To each and every one that's on this live, I love you from the bottom of my heart. If there's any on here who might think that I don't, you're wrong. I might not agree with you all the time. I might even get loud against you. But that don't mean I don't love you. For sure. I still love you. And I'm just encouraging everybody, take care of yourselves. Because if we don't take care of ourselves, nobody else will. That's the reality. We got. I'll talk to you soon. Call somebody up and tell them you love them tonight. Y'all take care. Peace.